Hello, this is news update number 48. So, a complete lockdown has been announced in Kerala, and some new rules have come to be followed over the 2 days, for which, as of now, it is announced. So, newspaper reports are there like, will Kerala be the epicenter of India's third COVID wave? Resurgence hints battle far from over. So, situations are bad. So, every newspaper has started covering it in detail because the numbers, if you see, it is like almost 50% of the cases in entire India is now in Kerala. So, complete lockdown on July 31 and August 1 has been announced, and it can be extended based on how the situation is improving. So, if you see here, complete lockdown, this is the tweet which came. This is the symbol of Kerala government. So, July 31 and August 1 because of rising COVID-19 cases. And if you take the map of Kerala, this is how the districts will be. Okay, there are 14 districts lined up like this. So, in this, the majorly affected districts, if you take, okay, this, if you see this Malappuram, this is 3931 cases, and this Thrissur, which is down, this is 3005. Then Calicut, which is Kozhikode, this is 2400. Then Ernakulam is here, again a very like a metro city. So here 2397. Then here again Palakkad, Kollam, Alapi. These are all southern states, if you see majorly, and Kannur is here. Okay, and Thiruvananthapuram is the capital, which is at the down, and Kottayam. So almost 6 to 8 out of 14 are like having huge number of cases on a daily basis. And so if you see the numbers, average daily cases being reported in the state are above 17,443. Okay, average, that means it is coming like 15,000 or 20,000 in each day. The state has also reported a high case positivity rate of this much, 12.93. And this weekly, this thing. So these are all data from the health ministry only. Okay, and new rules which have been announced for this 2 days. All state and central government offices and their autonomous bodies, corporations, etc., dealing with emergency and essential services and COVID-19 containment and management duties shall be fully functional, and officers, personnel of the same shall be allowed unrestricted movement. So these people who are dealing with the COVID-19 services, they will be allowed. Same like that, the industries, companies, organization dealing with the same thing will be allowed. Okay, 24/7 permitted to operate. Employees and vehicles of telecom and internet service providers shall be allowed movement on producing valid ID cards issued by their respective organization. Only essential staff or employees of IT shall work from office. Okay, so that is restriction is there since long time. Patients and their attendants or the persons requiring emergency need, eligible people intending to take the vaccination, they shall be allowed, but you should have a valid ID proof when you get out. Then the neighborhood shops will be allowed to open, which is dealing with this essential items like food, groceries, fruit and vegetables and all. But timing is 7 a.m. to 7 p.m. And home delivery of essential items shall be encouraged to minimize movement of individuals outside the home. Meaning the shop itself should deliver when you call them or telephone them. They should bring it. Okay, that is what they're telling. Same applies for hotels. The takeaways and parcels, like you going in person, is stopped. But home delivery is allowed. Meaning you can call or place it online the order and they can bring it home. So that is allowed in the 2 days. Then movement of long distance, bus services, trains and air travel are permitted. Long distance is allowed. Then movement of public transport, good carriage vehicles and private vehicles, taxis, all these to the airport, railway station and such kind of things. Who are traveling longer distances through train or plane, such people can travel. Others has to be indoor. Marriages and these things if already planned, it has to be registered in the COVID Jagrata portal, and they are permitted only through the valid protocols being followed, like this much count or whatever is there in the portal, you can go and check. So this is the new rules which is announced for these 2 days, which can be extended for further days. So if you see the vaccination rate in Kerala is much higher compared to the rest of the country. Okay, that means dose of vaccines are given. I think 50% of the people have already got the first dose already. Okay, even Sputnik vaccine has arrived in Kerala in different districts. So if you see, problem is not with that. Problem is the developing antibodies. Okay, people developing antibodies. A survey was done between June 14 and July 6 by the Indian Council of Medical Research. So that when it was checked, Kerala was at the bottom most. Okay, developing antibodies and becoming immune to this virus. That Madhya Pradesh is leading the chart and Kerala is at the bottom. And if you see yesterday's count, Wednesday, 22,000 cases were there. That is why I told average of around 17,000. And the total is like around 33 lakh. And even deaths are happening. 131 more deaths were there yesterday. So this is happening. So we'll see the reasons also at the end of this video why suddenly these kind of things are there. So this is the same thing, numbers which we discussed in the starting. And this is the tweet from central government. Like central government, they are going to send a team, a 6-member team headed by the NCDC director. NCDC, is the National Center for Disease Control, which is not a new body. It is there in India since 1963 under the Ministry of Health and Family Welfare. So they are going to send a 6-member team because they have to investigate like why these cases are rising and what is the state government doing. Okay, because state was once appreciated for its best effort. So why suddenly when all other states the count is low, how come Kerala it is high? Also last week you would have seen Supreme Court already slammed Kerala for these relaxations given on festivities, like Bakrid relaxations were given. So that Supreme Court did not cancel the order or government notification, but they warned them like this should not be done. Okay, meanwhile, the politics will be happening. The opposite parties and opposition, the BJP parties, these people will be again making use of that opportunity, and then again telling like blaming the Kerala model and telling like states like Uttarakhand and Uttar Pradesh had called off whatever the festivities and yatras and whatever they had. Meanwhile, Kerala gave this relaxation for a minority community. So this kind of politics is also happening. Okay, so who is right, who is wrong, that we cannot discuss here. But this is what the news items which I wanted to update to you. And you should remember, United Nations already honored that time's Kerala's health minister. Now the second term of the chief minister has come, and he has replaced her. She's not there in the cabinet now. So now, if you see, as I told, so the southern state, which has been lauded in the past for its best practices in COVID management, is now contributing over 50% of the positive cases in the country over the last 2 days. So situation was various people, various experts are telling different things. So the state has a high density population, 859 people per square kilometer, a large number of elderly population. That is at least 15% of the population are above 60 years of age, and high volume of lifestyle diseases already exist, like diabetes. Okay, so which makes your immunity also go down. So that is why maybe people are getting affected more. And low testing rate is reported by some newspapers, but I think Kerala is doing well in terms of the testing rate and vaccination rate and all. But these are different things told in different newspapers. And then the government has been telling there has been shortage of vaccine initially. Okay, but beds and oxygen things and all, if you see, it is not overburdened and state has the capacity. But last week suddenly the demand increased because that many patients were there. So we have to wait and see like whether this will go down. And the government stand, if you see, okay, have been telling like the second wave started late in the state, and about 50% of the state population are yet to contract the virus. So and we expected the increase. Okay, and there was shortage of vaccine. And in interview, this is the new health minister in the new cabinet, so told like it is not unusual. Kerala has been following the same pattern during the first wave too. The state accounted for almost 40% of the country's total COVID case in January, while overall numbers were on the decline. So they are telling like compared to the first wave, it is happening in the same pattern. Like we expected this much, and it is going on. It is now in peak around May 12th, and now it is going down because we have reached a plateau kind of curvature in the graph. If you take, so they are expecting that in the next 2 weeks it is going to go down, and it will be like how it is happening in the other states as well. Okay, so hopefully Kerala state will take in serious measures, because if one state has a problem and all other states are not having, they have to maybe find the people or take some strict action so that people don't get out unless it is for the most essential thing. Okay, these are pictures from there. So this is it what I wanted to convey through this video. And if any more doubts you have on the same thing, ask us in the comment section. But meanwhile, people in Kerala, stay indoor, stay safe, and get yourself vaccinated, because as I told, even Sputnik vaccine has reached certain districts in Kerala. So if your portal is not working, keep trying. It should be available in the coming days. Okay, so thank you and have a nice day.